Good morning, I'm Monique. I'll be demonstrating an IV piggyback. I have my MAR and I have my physician order, and we have Miss Janet Green, date of birth 4/13/1966. It says that she's not allergic to anything. The order states for furosemide 40 milligrams IV. I'm sorry. The order states for potassium chloride 10 MEQ IV piggyback every 24 hours, and that stays for 8 o'clock in the morning. It stays for 8 o'clock on my MAR and my physician. The medication are the same, and the names and date of birth matches on my physician order in my MAR. Okay. So I'm here in the nurse's station. She will be again receiving potassium, and it says 10 MEQ IV piggyback every 24 hours. The usual dose is 40 to 80 MEQ 24 hours. It says that each individual dose must be diluted in a larger volume of suitable IV solution given as an infusion. With this potassium, the rate of administration says a maximum of is 10 MEQ per hour, and my patient will be receiving 10 MEQ for 1 hour. We will be monitoring her potassium levels. Normal potassium levels from 3.5 to 5.0. I will make sure my patient has an adequate output. We will continue to monitor her cardiac, blood pressure, her heart rate, possibly putting her on a ECG to monitor that heart because it can cause some dysrhythmias. My patient currently has D5W running. I want to make sure that is compatible with the potassium. And the book states that it is. Okay, so I have my supplies here. I have my medicine. I want to make sure that it matches my MAR, potassium chloride 10 MEQ. Okay, and I have my label. I label it with the name of the medication, potassium 10 MEQ. Today's date 2/20/20. It's 0800 AM. My patient, Janet Green. The flow rate will be 125 drops per minute. And I make sure that this medication is not expired, and it doesn't have any floating particles, it's not any cracks, it's not leaking, and then it's not cloudy in the inside. So I have my supplies here. I'm gonna go ahead and put my label on. I'm going to prime my tubing. Make sure there's no air bubbles or anything in it. Okay. So now I will take my MAR and I will go to my patient's room. So I have everything. Okay. I knock. Good morning. Can you state your name and date of birth for me? And my patient states her name is Janet Green and her date of birth is 4/13/1966. I will go ahead and perform hand hygiene. Introduce myself, I'm Monique. The doctor has ordered for you to receive potassium through your IV. The reason we're giving it to you because your potassium levels are low. I'm going to make sure that you continue to have an output with it, and we will continue to draw labs on you to monitor your potassium level, and we're going to make sure we're going to continue to monitor your vital signs as well. I will check my patient's site Make sure no redness, no infiltration. Does it hurt there? She said no. Miss Green, you're allergic to anything? She says no. That's good. Okay, so I'm gonna check for patency. Alright, and it's patent. I had some flash return. Okay, got my medicine here. Gonna go ahead and lower it. And Miss Green, at any time during your medication administration, please let me know if you have any burning at your site. Just call to the nursing station. I'll be down here immediately. Again, I'm going to check my medication against my MAR. Have potassium here, and my MAR states that I'm giving potassium 10 MEQ, IV piggyback. Gonna scrub the hub, 15 seconds. Let the air dry. Take this off, make sure I'm maintaining sterility. Throat sterility. Air dry. Go ahead and open that up. All right, Ms. Green, again, let me know if you feel any burning at your site. Go ahead and count. To make sure I get the correct. If this was a pump, it will be given 500 milliliters per hour, but we're giving it IV piggyback, so I'll be giving 125 drops per minute. Try to get 31 drops per 15 seconds, and I'll let you know when to start. Start. It's a little too slow. Start. I'm gonna check it again for 15 seconds. Start. A little too fast. Check it again for 15 seconds. gonna check for a full minute now, and I'll let you know when to begin. Start. I'm gonna count again for 15 seconds. Okay. So I go ahead and let that run. Let my patient know again. Let me know if any burning going on at that site. So I come back and I perform hand hygiene. Tell my patient to identify herself again. Name, date of birth, Janet Green, and her date of birth is 4/13/1966. I see there's no infiltration going on, no redness, no leakage around the site. I asked if there any pain when I touch, and she states no. Well, Ms. Graham, I'll go ahead and discontinue. Your medication has completed, so I'm gonna go ahead and stop it. Go ahead and put this in an appropriate bag. Hang my primary back up. I'll go ahead and regulate my primary fluid back to its normal rate in administration. I make sure my patient is in a safety position, bed lowest in its lowest position, side rest up ×2. My patient has a call light. The bed wheels are locked. And we will continue to monitor her potassium levels and her intake and output and her vital signs as well. And this concludes my IV piggyback.